So we'll start off with some West Coasters. How about everybody here to here? Everyone here to here? Come this way, come this way. You'll be coming running if he calls for a bit of a help. So this guy you're looking after, 1 hour post, he's just bypass grafts, one of my patients, one graft, took me 5 hours on pump. He came off on a few inotropes, you know, neat milrinone, and but he should be all right, I've gone. So if you wouldn't mind just looking after him, this is his monitor, so just there it is, everything seems kind of okay, apart from things are looking a little bit less okay, and this kind of noise has started happening. What do you want to do? Yeah, shit. Yeah, everyone, come help. Let's get some help. Let's go.
Get the defibrillator.
Yeah, what, that thing there? That's good, yeah. Bring it over, bring it over.
Somebody check the airway.
Do you want to check timing? Have you got a timer on your phone or something? Okay, just do it.
Where's the defibrillator?
Do you want to make sure the defibrillators do that? So yeah, here we are.
Somebody's doing the batches quickly.
That's great. What you're doing up the airway there? That's doing well.
Okay, one here and one back.
That's not hard to bag.
Okay, charge.
Yep. Do you know how to charge these?
And everybody's clear. Charge. Clear. Charge again.
Success on the second. Yeah. Yeah. Okay, stand clear.
Everybody's clear. Shock. Clear. There we go.
Well, you know what? You've saved their life. The blood pressure is 82/51. Well done. Congratulations. So, fantastic. That went really well. That was quite quick. I've been on training courses. I'm a trained trainer. And what they say is you have to talk about the good points, you know, talk about a few issues, you know, and then round up with positivity. It's called the shit sandwich. So what went well for you? I'll start for this one. That went really well. We called for an arrest. You got a team round quickly. We started some massage. You got the airway, started bagging. You were checking, you know, feel the trachea, breath sounds both sides. And then you identified correctly that it was VF. We gave a shock. The first one didn't cardiovert, but you remembered the protocol of 3 stacked shocks, and the second one did work. We got in there really nice and quickly, and I reckon that patient would be fine. So you did very well. Step back there a little bit. Okay, East Coasters, they're pretty good, I have to say. I hope you guys are just as good. So let's have just kind of all of you. Oh yes, come forwards. Oh, that was a bad time. That was.
Why did you do massage instead of just shocking?
I kept that quiet because he hasn't done the full course yet. But isn't it difficult not to do massage? It's so difficult, isn't it? Stressful situation. You just.
What about precordial thumbs?
Yep, we looked into that, and a lot of the guidelines do correctly say if VT or VF is witnessed within 10 seconds, it's acceptable to do a precordial thump. We thought about it, and you know those 17 different iterations, it has precordial thump in it. It goes really badly. And when you talk to people that do a lot of defibrillation, it's like, well, you can precordial thump in 10 seconds or you can shock in 20 seconds. So I'm sure in all your intensive cares, a defibrillator's 20 seconds from every patient. I mean, there's usually 2 or 3, isn't there? So we thought it was a lot simpler just to get them on without massage and shock them, because a precordial thump, it's really designed for out of hospital, it's designed for witnessed known VFs. It's designed for a place where there'll be some delay. So we've tried both ways, and shocking them is better. Promise.
Till the moment he had the defibrillator, of course, if you have the defibrillator, you shock the patient.
Yeah.
As you said, you don't need to do a CPR. But if you don't have the defibrillator by the time it comes, and you don't have the tools to open the sternum.
So our recommendation is, if it's going to be delayed more than 1 minute, start CPR. That says it on the poster. I don't think there are any cardiac intensive care units that would take more than a minute to get a defibrillator. So if there is, start massage. But the point is, it's really difficult not to massage, isn't it? It's like it's in our heads.
So. You get some useful information by doing CPR and seeing what your waveforms, your arterial.
If it's VF, a quick shock's going to be the most useful information. So 3 shocks that fail, you just got to get in the chest. If it's asystole, we've got the pacing box. It's in PA. We have a different protocol. But let's have another practice. You asked a great question. You must be great. Come this way. Luckily, the whole of the East Coast is going to come helping if something bad were to happen.
I'm going to pay
So, okay, so this patient's just had an arrest about 5 minutes ago, brilliantly treated, 2 shocks. They've all gone to debrief, because that's what you should do after all arrests, shouldn't you? So they've asked you to look after the patient, and things seem to be going all right until suddenly some different little lines go on. And on, if I were to press the buttons correctly, let's die. Oh. Wait a sec, I'll just, let's, here we go, prepare to die. I'm not very friendly to I'm a sickie, am I? Yeah. Here we go. That's better, but not better for him. What you going to do?
I'd call the code team in.
Come and help, all East Coasters or everybody that fancies a hand.
I'll be the airway person.
So we're going to bag.
Yep, there's a bag around on all crash trolleys.
The trachea is midline.
Excellent. Yeah. Yeah, and you could even listen both sides if we'd remembered a stethoscope, which we didn't. Yeah. Yep, so if you're not familiar with Zoll, then either ask somebody or ask us. There's a big red number 1 you point it to. There's a big red number 2 to charge. And the big red button. Oh, it didn't work. Don't worry, it worked on the second time with the other group. So we've gone up to 200. We're charging, and it's real juice, stand clear. And damn, the second one didn't work. Maybe the third one will work.
Everybody clear?
Oh, that's a disappointment. Oh,
You want to be like, well, somebody else should be a CPR.
yeah, do that. It gets you off the decisions. Gets you off being team leader, really, doesn't it? Yeah. Oh.
Chest compression.
You'd open. Oh, that's a good idea. Look at all this opening stuff. Yeah. Hey, you're on an opening course. Here's a lot of opening stuff. Well, somebody's got to open. Someone's got to open. Yeah. Yeah.
Wash real quick.
Can we give medications? Or?
Yeah. You can follow whatever protocol you like. I don't mind. What would you like, medication-wise? Amiodarone, fantastic. 300 through the central line.
Do you want to be the IV giver?
Yeah. Choose someone quiet. Be a number 5. Yeah. You're number 5. Well done.
Wash. You don't care about wash. You don't care.
Yep. Let's take this one.
That is a good idea.
The wires can poke my hand.
Yeah.
That's all right.
Anybody have more betadine? There you go. You don't want some?
What's that?
No washing? Betadine while we're doing this?
I have the drape in my hand.
We have some.
I almost have it wrong. That's all right.
In theory, but when they're done.
Now, if you're not familiar with the drapes, there's a bit of a square, so make sure the square's in the middle, and that'll rip off once it's on. So yeah, nice. Nice one. Get in there. Yeah. Hey, East Coasters, encourage her. Come on, get in. Whoa, get in there. So open that up. It's slightly difficult to open, but there you go. There's one, and it pulls the other side. So we have a 5-piece set. The first thing would be a scalpel. Yep.
Careful, that's a blade.
Yeah. Scalpels aren't really sterilizable, so they're usually on the
Oh,
top.
wait, time out.
We've been evil and put 1,000 pieces in there just to upset you, but you've correctly found the right stuff.
Yeah, sure.
Yep, so pull the skin apart. There's some wires in there. You better
Pull up each one.
one tugging, one cutting.
Will we be on the 10 minutes?
We're timing. That's it. Throw it over your shoulder at the nearest surgeon. It's their fault.
Suction.
That's great. Yeah, and there's a There's a retractor somewhere.
Right now.
Yeah, that's it. Hey, you're good. You do this for a job. You're great. Yeah, crank it open.
Suction out of the way.
Yeah.
Go get the Iron Man. I know.
Yeah. Yeah, there's a bit of a gush of blood. You've relieved a little bit there. The heart's wriggling and a wiggling.
So there's actually one in there.
This patient has a heart. You only operate on Republicans. Yeah. Okay, how many joules would you like? See if you, yeah, it's VFing. Is it? Keep it shiny side up to the heart. How many joules would you like?
10 to 20.
Yeah, okay. Well, there isn't a 10 to 20 setting, but...
You got to set it to internal.
Yep, so charge. I'm afraid we'll have to shock from here, so... And I'm afraid not, yeah. And, yeah, shock. Wow, look at that. Blood pressure 85/51. You've saved a life. Great.